Hello, my name is Carolyn Swenson. I have a background in nursing as a family nurse practitioner, and I studied public health with a focus on epidemiology. I currently provide training and consultation on screening, brief intervention, and referral to treatment to address alcohol and other drug use, suicide prevention, and on motivational interviewing skills. A brief intervention is a short conversation between a health professional and patient to address alcohol use that is considered risky or harmful. In some cases, the patient's alcohol use is already causing harm to their health or other areas of their life. In other cases, the focus is to raise awareness of alcohol use that increases the risk of future adverse outcomes. Alcohol brief interventions are indicated in these situations: patients that drink above the moderate limit, patients that engage in episodic binge drinking, underage drinking, alcohol use during pregnancy, and/or alcohol use that could worsen chronic physical or mental health conditions or adversely affect other areas of life, such as work, relationships, or school. Brief interventions are usually provided after a patient has screened positive for risky or harmful alcohol use. Examples of screening questions that are commonly used with adults include the NIAAA Single Alcohol Screening Question or the Audit C. People often ask, what do we mean by brief? The length may vary and depend on factors such as the amount of time available and other health concerns that need to be addressed, the complexity of health and life circumstances related to alcohol use, and underlying social needs or co-occurring physical and mental health conditions related to alcohol use. Even 3 to 5 minutes of focused conversation with a patient can open the door to change. Brief interventions can be used in healthcare and other community settings, provided by multiple professional and paraprofessional disciplines, and can be effective with adolescents, adults of all ages, and in perinatal settings. The United States Preventive Services Task Force recommends screening for unhealthy alcohol use in primary care settings in adults age 18 years or older, including pregnant women, and providing those who report unhealthy alcohol use with brief behavioral counseling interventions. Patients may be especially open to engaging in a brief intervention with a trusted primary care provider. How effective are brief interventions? Brief interventions for moderate risk alcohol use are more likely to result in change. Outcomes in the research on brief interventions include a decrease in self-reported consumption by 3 to 4 fewer drinks per week, and a 10 to 12% reduction in unhealthy use at 1 year. Evidence that brief interventions can prevent patients from developing alcohol use disorder is currently lacking. Brief interventions for moderate to severe alcohol use disorder are less likely to result in significant change, and the evidence is mixed for emergency department and inpatient brief interventions, especially since many patients who report unhealthy alcohol use in those settings will have a moderate to severe alcohol use disorder. The goals of an alcohol brief intervention may include decreasing or entirely stopping alcohol use, preventing or minimizing potential harms associated with alcohol use, such as injury to oneself or others, health effects and/or legal, school, work, or relationship problems, or a plan to explore alternate approaches to managing stress, loneliness, boredom, anxiety, or other life challenges that are often associated with unhealthy alcohol use. Even when a patient does not choose to change alcohol use, a brief intervention can lead to greater insight and openness to exploring how alcohol affects things that are important to them, such as their goals and values. Although we cannot instill motivation to change in a patient, a brief intervention may plant a seed that leads to future change. The brief negotiated interview, known as the BNI, is one widely used format for brief interventions. A BNI typically includes the following steps and components: building rapport, exploring the pros and cons of the reported alcohol use, providing feedback about why you are concerned about the patient's alcohol use, assessing motivation to change and exploring ambivalence about change, and negotiating goals, next steps, and follow-up with the patient. When time is very short, an abbreviated brief intervention can be provided using the elicit, provide, elicit approach. First, elicit what the patient already knows about alcohol and health or what information they might be interested in learning. Then, provide information in a neutral manner, such as how alcohol can affect sleep or health conditions, such as depression or cancer risk. Next, elicit what the patient thinks about the information and how it might apply to them. Effective brief interventions incorporate the spirit and practice of motivational interviewing, also known as MI. Motivational interviewing is a way of discussing behavior change to resolve ambivalence and strengthen motivation and commitment to change. The spirit of MI includes compassion, acceptance, empowerment, and partnership. Compassion helps cultivate self-compassion for patients who might be feeling shame about their alcohol use or discouragement about their ability to change. Acceptance includes affirming the patient's autonomy and genuinely trying to understand their perspective on their alcohol use, which can decrease defensiveness about changing. Empowerment recognizes the patient's expertise on their life and seeks to elicit intrinsic motivation, their insights into reasons and potential benefits of changing their alcohol use. Partnership focuses on collaborating with the patient using shared decision-making to identify goals, next steps, treatments, and other types of support to facilitate and sustain change. Motivational interviewing skills for brief interventions include asking permission to discuss alcohol, offer feedback, and express concern, open-ended questions to help move the conversation forward, reflections to show accurate understanding of the patient's perspective and highlight any expressed desire, ability, reasons, or need to change alcohol use, affirmations of goals, values, intentions, and efforts, then summaries that move from the why change is important to how to initiate change. Two specific approaches to enhance motivation to change that are often used in brief interventions are asking about the pros and cons of current alcohol use, and using a 0 to 10 ruler to identify importance and confidence about changing. Let's look at a case study of a 76-year-old male who lost his spouse 6 months ago and is at a visit with his primary care provider. The patient completed screening with the Audit C and reported consuming 2 to 3 standard drinks most days for a score of 5. He has hypertension and atrial fibrillation. At intake, he also responded yes to feeling down, depressed, or hopeless in the past 2 weeks, and his blood pressure is higher than at his visit 3 months ago. Keep in mind that patients may not always recognize the many ways alcohol is related to health and overall well-being. A helpful way to begin a brief intervention is to thank patients for answering the alcohol screening questions and to let them know that you ask about alcohol and mental health as part of providing high-quality care. Next, you ask this patient if it would be okay to discuss his results. He agrees to have the conversation. You explain that the lower-risk drinking limit for men after age 65 is no more than 1 drink a day, and you tell them that as a person ages, alcohol is metabolized more slowly, which means it is more likely to have harmful effects on his health. For example, alcohol can make it harder to control high blood pressure and atrial fibrillation. Then you ask what he thinks about the information you shared. He tells you it's new information and sounds a little bit concerning. Next, you ask what he likes about his current level of drinking. He tells you that evenings are especially lonely since his spouse died, and some nights a few drinks take the edge off of the sadness and help him get to sleep. You offer a reflection in response to what he shared with you. Next, you ask about any negative things related to alcohol. He mentions that he sometimes feels even worse the next day, especially when he wakes up in the middle of the night and can't get back to sleep. You note that alcohol can disrupt restful sleep, and this is even more common as a person ages. Then you summarize both the good and the not so good things he mentioned about alcohol. The patient responds that this sounds about right. You ask if it would be okay to share information about how alcohol can affect a person's mood, and he agrees. He responds that maybe this is happening with him, but who knows? Since he said he only has 2 to 3 drinks on some, not all evenings, you explore this. He tells you that on weekends he spends time with his children and grandchildren and doesn't need alcohol to help him get to sleep. You offer another reflection about how spending time with his family seems to help. Next, you explore his motivation to change using a 0 to 10 ruler question. He chooses 5, somewhat important but not extremely important, and you ask why a 5 and not a lower number. He responds that he really wants to sleep better, but he's not sure how he will handle evenings when he's alone. You ask what ideas he has for finding more social support. He tells you he has been thinking about contacting a friend who also lost his wife recently to make plans to go to concerts or other community events. You note that this sounds like a great idea. You also let him know that you could connect him to a grief support group for older adults. Next, you ask about any changes he might want to make to his alcohol use. He responds that he would like to try cutting back to 1 drink on the days when he has alcohol to see if it makes any difference in his sleep. You affirm this as a positive next step and ask about his confidence about being able to make this change. He says that he's pretty sure he will be able to stick with his plan. You ask if it would be okay to follow up in a couple of weeks to see how his plan to cut back is going and how he is doing overall. He agrees, and you close the conversation by thanking him for his openness to discussing alcohol with you. Alcohol brief interventions are short, structured conversations that focus on sharing feedback about how alcohol affects health and other areas of a person's life, then enhancing motivation to change. Effective brief interventions include asking permission to engage in the conversation and offer feedback about alcohol, affirming autonomy, genuinely seeking to understand the patient's perspective on how alcohol is affecting their health and life, and collaborating with the patient to identify goals and next steps. The emphasis on patient autonomy takes pressure off of a health professional to try to persuade a person to change. In fact, that approach often backfires and increases reluctance to change. Although we cannot instill motivation in patients, we can open the door to the possibility of change by how we engage in the conversation. When planning goals and next steps, patients have expertise on their lives that no one else has, so they will often have insights into what will help them make and sustain change.